what's up today? Have you finished your work and ready to take a rest in peace with eBESS? Today, we are talking about how to remove only the superficial layer of ligamentum flavum. We must think the superficial and deep layer separately as different structures. The purpose of removing the superficial layer is to expose medial and ventral surface of the laminar bony margin. You are watching two structural layers of ligamentum flavum. We must try to see the structures as separated ones during BESS. The superficial layer covers the lamina a little bit over, so at first, the distal and medial margin of the upper lamina is not seen well. The deep layer lies down at the same level of the lower lamina. So you'd better think the upper portion of the level of the distal lamina as the superficial layer, and the lower portion as the deep layer. When removing the superficial layer at the ipsilateral side, we start detaching it at the distal portion, numbering 1, at first using a bishop curette, and next, moving to the lateral and proximal portion to separate it from the distal surface of the upper lamina. It is very thick and tough, so that strong scratching is needed. After making it released and elevated and get a little free space for the other instruments. The floppy ligamentum flavum can be removed by using a Carrison punch and shaver. Shavering is a convenient and effective technique for debridement of soft tissue in endoscopic surgery. Flavectomy on the contralateral side is a little bit different from that in the ipsilateral side. We starts the lateral detachment of it from the medial surface of the upper lamina. The medial surface of the upper lamina should be clearly exposed before accessing the deeper of the contralateral side. The superficial layer can be divided at the same level of SP base and go forward deeper till touching the medial surface of the upper lamina. The thicker superficial ligamentum flavum in the middle covers your endoscopic view, so making it thinner is necessary before accessing and decompressing the contralateral sided spinal canal. The final purpose of digging the ligamentum flavum deeper is to see the medial surface of the upper lamina. After 3 mm resection of it, we can expose and see the SAP tip. After exposing the ventral bony margin of the contralateral lamina, you are ready to decompress the real pathology locating deeper inside of spinal canal. The bishop curette and Freer instrument are very helpful to divide the ligamentum flavum into 2 layers. That structure should not bother your view in the middle of spinal canal, so making it lower profile is mandatory in the middle. And ventral bony margin of the contralateral upper lamina should be exposed clearly for serving a view for chiseling of contralateral side lamina. Please keep the deep layer of ligamentum flavum safe after finishing bony procedure. The deep layer can protect the dura during laminectomy by chiseling or burring. After superficial flavectomy, you can see the spinal canal clearly and get the orientation well. With this step of procedure, the endoscopic view shows you the ventral margin of the contralateral upper lamina for chiseling, and then SAP tip also. Well done. Let's go out and play with your kids.